Hi everyone, welcome back to the channel. Americans are losing trust in the CDC. The Annenberg Public Policy Center of the University of Pennsylvania just released a survey result on Friday, January 27, showing us about 72%, or about 3 of 10 Americans, do not have confidence that the CDC is providing trustworthy information about the means of preventing and treating COVID-19. This value fell from 77% only 2 months ago. CDC's messages have not been very clear since the early days of the pandemic. For example, in the beginning, mask use was discouraged, and then a month later it was encouraged. And just before the Delta wave in the summer last year, they again said mask was not needed in fully vaccinated people. And more recently, they said if you can have the option, it is best to have N95 or KN95 mask. In their defense, these frequent changes in the message were due to new scientific findings in the rapidly changing pandemic situation. High-level CDC official has also instilled stigma in public by using the term pandemic of the unvaccinated to suggest the vaccinated people are not part of the ongoing pandemic. In fact, there is plenty of research that shows although vaccinated people carry the virus for a shorter period of time than unvaccinated people, they are still relevant in the course of the pandemic. Real-world observation also shows vaccination alone is not enough to curb new cases in countries such as Israel and Sweden, where they have a high vaccination rate. Statistics have shown that vaccinated individuals have a lower risk of deaths and hospitalization due to COVID. And we often hear that many deaths of COVID could have been prevented if they had received their vaccines. But consider nearly 2/3 of the COVID patients in the hospital had at least one chronic disease, such as obesity, diabetes, hypertension, and heart failure. Perhaps it is time for Americans to rethink what is happening to our health. Many chronic conditions are preventable or modifiable with lifestyle changes. This is not new information, and CDC is aware that the US has not done enough to prevent chronic diseases. Now, this article published on the CDC website before COVID-19 pandemic had clearly said that the US did not use enough strategies to prevent chronic diseases. If American physicians and other public officials had spent more time and effort toward preventing and better managing these types of chronic diseases, many COVID patients would not have needed hospitalization in the first place, and many of them would still be alive. But this is not entirely their fault. Insurers do not financially encourage physicians to take the time to prevent diseases. The result is that physicians are ordering more tests and prescribing more medications. This article, published in the Mayo Clinic Proceedings in 2013, questioned how many contemporary medical practices are worse than doing nothing or doing less. In the article, it was mentioned that in a given year, almost half of the established medical practices that are tested are found to be no better than a less expensive, simpler, or easier therapy or approach. Take diabetes, for example. A study released in July 2021 found 40%, or 2 in 5 people in the US who died of COVID-19 had diabetes. A meta-analysis also showed diabetes is the most important cause of COVID-19 death in Europe. The UK Office for National Statistics also confirmed that diabetes was the #1 pre-existing condition among COVID-19 deaths in England and Wales in the last 3 months. Why? It is because diabetes is known to weaken the immune system, and a competent immune system is the key to fighting the coronavirus. But when I was in pharmacy school, I remember we spent so much time learning how to juggle different medications to manage glucose or sugar levels in patients with diabetes. This is also a topic all physicians need to master. But we still have more and more people developing diabetes. An article published in 2004 estimated that there would be 366 million people with diabetes in 2030, but we have already passed that number in 2022. Why is this happening? It is because the idea of chronic disease prevention was not emphasized enough. Indeed, we cannot change genetic factors that are linked to a higher risk of developing diabetes. We can modify lifestyle factors such as diet, exercise, sleeping habits to prevent or delay diabetes onset. The most common form of diabetes, type 2 diabetes, does not just happen overnight. And it is not a rocket science level of difficulties to make small changes in our daily life to prevent the disease from happening. To wrap up this video, let me remind all of us what CDC stands for. It is Centers for Disease Control and Prevention. Perhaps it is time for the CDC to put more narrative on how to prevent the next pandemic or variant by preventing chronic diseases first, and not focus only on getting vaccinated up to date. At least one of you asked me, when the pandemic is over, what am I going to talk on my videos? Now, my goal for this channel is not only to provide facts and scientific breakdowns of COVID topics, but also to share my knowledge in health science. I know many of you come to this channel and watch my videos solely for COVID updates, and I'm grateful for that. But we all know the pandemic will end, and I will make fewer and fewer videos that is directly related to COVID on this channel. And I know I may lose some of you in the process. But if you choose to stay with the channel, I'll be honored to share what I know so that we can all live a better and healthier life. Are you with me? That is all for this week. Thank you very much for watching, and please stay safe, stay healthy, and I'll see you again next Sunday. Bye.